Thank you. Now we are going to have Dr. Özden Şener to present Turkish medical system. Please, Dr. Şener.
Thank you very much, Mr. and Mrs. Presidents, dear colleagues. I'm glad to be here and thank you for your invitation. That's very kind of you. I'm going to present a 20-minute speech about health system, but also transition of the health system in Turkey. I have just heard some complimentations from Dr. Dalkılıç. He says that it's better than before in Turkey. Well, pardon? Yeah, I know that. Okay. Yes, Mr. Minister of Health mentioned that it's very important the impressions of the things in press and media. Of course, in Turkey, yes, we see everything is going to be well, and everything is better in Turkey about health. But let's see in Turkish Medical Association's view. Okay, this is my presentation actually. If this is enough, we can stop, but I will tell you a story. We don't have a referral system in Turkey. I mean, not obligatory to go to the primary physician, then you go refer to the other steps. And we have a compensation fee. We pay for to get health. We buy health. And we are paid as physicians by patients, the number of patients, the number of the operations. We see the patients and we get money. Okay, it's logic. If you don't work, you cannot get money. And we see that there is a privatization of the system in Turkey. What do we feel? We will see we will see the surveys about the patients and physicians, but we see that we are not happy. The patients are not happy. One of the important things is, of course, the outcomes. What happens to the patients after treatments? There's a good example of you, sir, from Netherlands, and we don't have that kind of figures, but let's see, is it possible or not? Okay, this gentleman is very famous in Turkey. You know, he's the, oh, you know them, you know him, good, great. I'm very proud. Okay, President of Turkey, Recep Tayyip Erdogan, is a quite strong leader. And of course, health system transition needed a strong leader. Everywhere, yes, everywhere, to change everything. Okay, this is our Minister of Health. And this is an official from World Health Association. No, I'm joking. This is an official from World Bank, and this is the President of Social Security Service of Turkey. The award is, well done. You did very well in healthcare transition in Turkey. It's not about health. This is not a person about health. This is not a person about health. They're money persons. Okay, this gentleman was our Minister of Health, Recep Akta, another Recep. Recep Akta Now, I think I thought you didn't believe me, then I put the slide in Turkish here. But in English, he says so. Show your test results to different physicians. We go to several shops for buying clothes. We should also go to several doctors for the same disease. This culture, it's a cultural thing. This culture should be settled. And we did it. We obeyed it, yes. And the number of physician visits was in 2002 was it was 3.2. In 2012 it became 8.2. It was the same in 2012, but this figure is from 2014.
And
yeah, this increases actually. 200 million visits a year, 690 visits a year. So maybe it's good, I don't know. But the number of computerized tomography increases as well. This is, can we make it a little bit dimmer? Işığı azıcık azaltabilir miyiz? In 2008, it was the 6th year of the government, AKP government, who started, let's say started transition. I mean, after 6 years, it was 5 million. In 2004, the number of CT examinations were 12 million. This increase is not acceptable, simply. And the number of consumed drugs as boxes is also increasing. It was 750 million boxes a year. And after 10 years, 12 years, it is 2 billion boxes. 2 billion boxes. We consume as people. We are performed X-ray as people. And the queues, the waiting lines in the hospitals after this increase. This is a cardiovascular surgery outpatient clinic. The waiting line number is 99. This is from orthopedy. It's a hospital from Ankara. 183. The same day, the same doctor. You wonder how. I wonder how. I wonder how. But we are pushed. We are forced. Otherwise, they fire us. They punish us. In two ways. Either by power or by money. If you don't have enough money to spend the amount, then you do this. Or if you don't do this, they would either send you to other cities, regions, or they push people to show violence against you. I will show it. Okay, I told you that there is a privatization in Turkey. Yes, there is. The investments, this is the number of hospitals by years in 2002. These are the darker ones are state hospitals. The lighters are private hospitals. Look at the figures. You don't need to read the numbers. You can see the color. Pale is getting bigger. The other doesn't change by years, roughly. And the number of hospital beds, of course, the bed number is not a strict quality measurement, but okay, they do investments. Private sector make investments on hospitals, and state stops, ceases. In state hospitals, the number of the patients applied to the doctors multiplies by 2.5 times in 10 years. In university hospitals, it is 3 times, okay. In private, 13 times. 13 times. It's increasing. Okay, we know that. I admit that we are lack of physicians in Turkey. If we feel comfortable, because in the other days, in the past, when TMA said that, okay, the physician number is enough, but for what? For a good working health system, it would be enough. But in this case, for this kind of pushing toward going to the hospitals, it is not enough, of course. I mean, if every apartment has a doctor, it wouldn't be enough. I don't think so. And for 100,000 people, we have 172 physicians, but EU has twice as Turkey. Then it's logic to produce more physicians. Produce, because it's market thing. Yes, we had 10 years ago 46 medical faculties. Now we have 93 medical faculties. With the new ones are lack of quality, enough quality facilities. They don't have enough quality labs, enough quality and enough number of educators, teachers. And look at the increase. Look at the increase. We had 5,000 enrolled students in 2002, and we now have 12,000 enrolled students, medical students. It's not safe. What about the finance? What do people do? Of course, we pay taxes. And also, if we get an illness, if we need to see a doctor, then we should pay premiums. Everyone should pay premiums. This is social security system of Turkey. General health insurance premiums are taken from anyone who has an income of 1/3 of the minimum wage. Not 3 times, 1/3 of the minimum wage. And we have compensation fees. In older times, we didn't have this. These compensation fees are per visit. We pay when we go to a doctor in state hospitals. And if we have a prescription, we pay for it. If the doctor says that you need not 3, 4 drugs, that means a punishment for us because we pay more. And if we are retired, we pay 10% of the prescription bill. If we are working, we pay 20% of the prescription bill. How much are they? Let's think about it. It's about 30 Turkish liras, 40 Turkish liras, which is more than monthly milk money of a child for one disease. And we pay 300% compensation for exceptional treatments. If you want to deliver without pain, then you should pay for it. It's luxury. You should suffer. And laparoscopy, arthroscopy, yes, you should pay 3 times the real price. If you go to, because you know the state hospitals are very crowded and the doctor has 3 or 5 minutes to see you and to decide about the diagnosis, then you go to private hospitals, yes, you do that. And you pay 200% of the bill, described bill. And we have a primary healthcare system, which is an important part of the transition. We have 4,000 or 4,500 people and one physician. He or she should keep under control all of the primary care service of them. And the primary care physicians are working on a contractor basis. They can be fired easily, so they should do everything. They have duties like changing the lamps, doing the calculations of the everything, and there are many jobs for them, except the medical jobs. They should wait, not go to the houses and find children for vaccination. They should wait and ask them to come. If they don't come, then polio is back. If the children don't come, then measles is back in Turkey. These are from northern eastern part, in that part of Turkey because of Syrian war, the moving people. But we don't protect our children. We cannot protect our children, and our children are suffering from these diseases. So, well, this is a patient satisfaction survey. Do I have time? Of course I have, but...
Yes, we're going to reply.
Okay, thank you. This is a patient satisfaction survey. Of course, it doesn't mean much, but it says something. It's Ankara Medical Chamber work. 5 questions. Is it all right? You pay for your health problem? Only 9% says it's okay. Was the duration of the it's clever. I cannot say anything about it. But was the duration of the visit satisfactory? Only 40%. Yes, it's okay. Could your doctor listen to your complaints thoroughly? Only half of the patients thinks like that. Could your doctor examine you thoroughly? Less than half of the patients admitted it. Are you satisfied with the diagnosis and treatment? Only 1/3 of the patients are happy after leaving the examining room. What about the physicians? In Ankara also, 4% is hopeful about the future. 6% think that this system provides high-quality health care for patients. 94% think this system's approach is see more patients however you see. 88% think this system puts patients' health under risk. this is very serious. And only 3% think that people will get a good quality healthcare when the transition is completed. We don't see, we accept what we do is not good for the patients and it's dangerous, but we are forced to do that. This is originally written by American people who are not physicians, and it has been written for the whole world. It is the guide for the reformer, healthcare reformer. This is in Turkish, and 78 page is very important. The book suggests the reformer, that the others who are not agreeing with you are your foes, enemies. And he suggests, the book suggests the reformer that say those people that people that those like TMA, medical associations, it's written there, that they are a small group of people who are thinking, thinking their own profits, and don't let them to be seen on media. That's why I'm here. And yes, reformer did that. Reformer made, but these are Turkish, I'm embarrassed to read them in English. Reformer says that some, not all, but physicians are bad people. They work for money, they want money, things like that. And the result is this. The result is this. These colleagues of ours has been deceased, has been killed, one exception I will tell, has been killed by patients or patient relatives on working hours in their hospitals. Can you see the increase? It's getting more and more. And now in Turkey, Melike Erdem incident was a suicide after mobbing of the, let's say, government. Now in Turkey, 31 health workers are attacked in every 24 hours, and 1/3 of them is physical attacks, physical. The others are insult. So we cannot say that this transition is good. We cannot feel safe in Turkey with this transition. We don't feel safe for ourselves, and we don't feel safe for our patients. Thank you very much.